Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about the topic vaginal discharge. Normal vaginal discharge. Vaginal discharge or normal vaginal discharge is the normal fluid produced by glands in vagina and cervix. It helps to keep the vagina clean, moist, and protect it from infections. It is actually an involuntary discharge. That means the woman does not know it is happening, or it is involuntarily produced in her body, just like the tear glands in our eyes produces secretions to keep moist our eyes, or when we do exercises or when we work hard we sweat. The sweat glands in our body produces sweats. These are all involuntarily happening in our body. Just like that, the women's body, inside the women's reproductive structures, to keep it moist and protected from the infection, fluid secretion from the glands around the vagina and cervix involuntarily in her body is called vaginal discharge. It happens every day in her body, and the difference is the amount of secretion can increases during the time of sexual thoughts or sexual intercourse time. When the person is excited sexually, the amount of these secretions or these fluids secreted from the glands increases. Now let's discuss on the normal vaginal discharge, the involuntarily produced fluid, or about the involuntarily produced fluid from vagina. Let's go deeper into the topic. The normal vaginal discharge is usually clear white or off-white in nature. Sometimes it is mild smelling or it is odorless. It is usually thin, sticky, or slightly stretchy. The main important point is it is not same in every day. It varies during the menstrual cycle. When the woman is nearing the ovulation, the texture of the discharge may differ. Many women notice more discharge around the time of ovulation. So it's also involuntary, the time of ovulation. The amount of discharge is more in some women. That is also a normal sign. There is also increased discharge during the time of pregnancy. The other point is the texture or the change in nature of the discharge can occur due to hormonal fluctuations. So these are all normal. Now let's look into the abnormal nature of vaginal discharge. You should consider medical evaluation if the discharge has a strong or unpleasant odor, if the discharge is yellow, green, or gray, if it looks frothy or like cottage cheese like a structure, if it is accompanied by itching, burning, redness, pain, or fever, or the discharge contains blood which is unrelated to menstruation. These symptoms may indicate infections such as bacterial vaginosis, vulvovaginal candidiasis, trichomoniasis. Okay? Now let's look into the next condition. After pregnancy and childbirth, it is common for women to experience increased vaginal discharge due to hormonal changes. Okay? Postpartum discharge, called lochia, for several weeks after pregnancy. Temporary changes in vaginal moisture and secretions can occur after pregnancy. It is completely normal. So you should note that the normal vaginal discharge is usually involuntary. Women do not consciously produce or control normal vaginal discharge. It is natural secretion from vagina and cervix that helps keep vagina moist, remove dead cells and bacteria, maintains a healthy vaginal environment, and protects against infections. The amount can vary from woman to woman and may change due to menstrual cycle, ovulation, pregnancy, breastfeeding, hormonal changes, and stress or certain medications. You should note that stress can also change the amount and structure of the vaginal discharge. Many women notice some discharge on their underwear daily, and this is often completely normal. So next, let's go to the topic, or let's go to the question: vaginal discharge breaks wudu. According to Shafi'i madhab, if the normal vaginal discharge exceeds and reaches the outer area of vagina, it breaks the wudu. So this applies even if the discharge is involuntary and completely normal. So the important point is normal vaginal discharge is natural bodily function and it is not sinful, dirty or sign of poor hygiene. It is simply normal physiological process experienced by many women. Now let's discuss or distinguish between the normal the vaginal discharges and its appearances. According to Shafi'i madhab, normal vaginal discharge, that is, its appearances usually clear or white. It's everyday moisture. Madhi or pre-arousal fluid. It is clear, thin and slippery. Mani, it is orgasmic fluid, usually released from orgasm and sexual climax. Menstrual blood, that is menstrual bleeding. Postpartum bleeding, that is nifas, bleeding after childbirth. Let's look into the practical examples. You notice a small amount of clear white discharge on your underwear during day. This is normal vaginal discharge. In Shafi'i school of thought, you would renew the wudu before prayer. If you experience a clear, slippery, thin fluid after romantic thoughts or arousal, this is likely madhi, that is pre-arousal fluid or pre-sexual fluid. What you have to do is wash the affected area and renew the wudu. When you experience orgasm, that is mani, the ghusl is required before prayer. Okay. Now the point is, if the normal discharge is occurring throughout the day and makes it difficult to maintain the wudu, then many scholars apply the ruling of a person with a continuous excuse or madhab. Now let's look into the different opinions in different schools of thoughts during normal vaginal discharge. According to Shafi'i madhab that we talked about earlier, it generally breaks wudu. According to Hanbali, it generally breaks wudu. According to Hanafi, it breaks wudu. According to Maliki, after most lenient regarding normal physiological discharge. So after many modern scholars have revisited the issue in light of medical knowledge that normal vaginal discharges and naturally involuntary bodily secretion and that is present in healthy women and often continuous. As a result, some contemporary scholars adopted more lenient views, especially for women who experience frequent discharge and would otherwise face significant hardship in maintaining wudu. So they say you get the excuse. So that's all about today's topic. We are stopping over here today's topic and we'll come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.